with these viruses. You have to take tough decisions that in the interest of Sierra Leone. We should not link it to try to score political points. And also, I would kindly ask the Minister of Health if we can see what the structures are as at now, because it's only when we know what's available, then we can be able to advise that we have to beef up this area, whether it's contact tracing, whether case management, whether it's getting the facilities ready and so on. But for me, it's a pleasure, and I look forward to giving my very best.
But Echi, like I'm sure I sent you a message that now that we have, from the military point of view, because what we did with the Ebola operations was to do the military kind of tactics. Now we have two areas of interest. The one I sent to you was just Guinea, but now we look at Liberia. And as a military man, you always have what we call eyes on. Now that is happening in Liberia and Guinea, we have to pay considerable attention to what they are doing, because their carelessness, could be very detrimental to Sierra Leone. So we have to follow Liberia and Guinea, what they are doing closely. If they are very careless about it, and then we will know what to do next. But for the meantime, since both of the cases in Liberia and Guinea, they are imported cases, we have to look at our borders as well. Because for now, we have no contact in Sierra Leone. We have no link in Sierra Leone. But it could be an imported case from either Guinea or Liberia, or from the Lungi airport. So those are the areas we have to monitor closely if we have any outfit like the surveillance team or whatever, to look at people coming into Sierra Leone. Let's see how those come into Sierra Leone. Let's see how they look, if they look sick or whatever. If we have we can get a structure in place, but not that we are pushing them into operations right away. But we can get the structure in place. We can get our surveillance team, we can get all these other things, and we need to deploy them at the border as early as possible if we can't close the border altogether. And then we know we have to do a lot of community engagement, talk to locals. We have to do a lot of sensitization, what we used to refer to as we used to refer to them as meeting the people, engaging them, or we need to talk to the people. We don't have anthropologists to look at their behavior and how they behave. But now it's better we start to talk to them. We start to send out a lot of jingles. We start to do social mobilization to let them know if this should happen, this is what we should do. For now, that's all I'll say for now.
Thank you very much.
Yeah. Your Excellency, Honorable Ministers, ladies and gentlemen, I must start by commending His Excellency for your display of leadership, because the very first step to defeating any crisis or any disaster is leadership. In the absence of leadership, no matter what you do, it's not going to succeed. So when I got the call this morning, I'm a big believer in data. And almost all the operations and everything that transpired during Ebola, I think I have almost 90% of that in my little iPad. So what I did was to dig up some of the information, try to tease some ideas apart, because I also believe that you will hear and forget, but you will read and you remember. So I have some briefing notes, which I have basically labeled as prevention stance and operational readiness, which I can share with you, and I will just take you through that very briefly. There are 3 extra copies here that you can look at. I have come up with a few ideas as we talk about the prevention and at the same time operational readiness. We need to have people and teams in place. We need to have standard operating procedures, SOPs basically. We need to be thinking very seriously about transport, logistics and supplies. We need to be thinking about the ITC system. And over and above all, we definitely need a governance structure for this response. While I have tremendous respect for the Ministry of Health and the role they will definitely play when it comes to a pandemic of this nature, I really believe that a governance structure at this point is going to be very critical that can work with the Ministry of Health in different areas. And as a result of people and expertise, we have that in Sierra Leone. It will surprise you to know that most of the interventions that we use during our response is what they are using now in Europe and America. We were criticized for the 3-day sit-at-home exercise. And I told them at the time, there is no textbook, no classroom to fight Ebola. The same way we have the COVID-19 at this point is going to be people being creative, people being very, very much ingenious to come up with what ideas. Some of the ideas for which we are lambasted as human rights abusers, locking people up and everything. Just Saturday, I got a call from the Deputy Chief of Mission at the U.S. Embassy who told me, Steve, some of the things for which you guys were criticized is what is going on right now. And I basically joked with her and I told her, I said, well, they must have learned very well from us. Absolutely. So I have a few areas taking into consideration the key ministries and the different personnel that we need to really put in place. I have a database of most of the people who basically perform in the world response. We can activate that within 72 hours at any given point. In addition, of course, the young man like Mahmoud Idris and I, initially the 3-day lockdown, he was part of it, and his idea about planning and bringing people in with the expertise was very useful. He single-handedly planned the Western Area Surge, which was a great success. And when he was leaving, he told me, he said, hey, Steve, Yvonne has been working with me. The best we can do is please hire Yvonne. Let's get Yvonne. And I went to the CEO. I said, well, you know what, Mahmoud is leaving. Let's get Yvonne in. Mahmoud, Yvonne, Obi, and the rest of the other people, we have a WhatsApp group. So these are people I can activate within the shortest possible time if the need arises. Now, on the different teams that I was talking about, and I crave your indulgence to be patient with me a little bit. Okay? We have talked about the Ministry of Health and MOHS. Basically, they can take care of all the clinical case management and the IPC role. They can definitely supervise and monitor all the labs for testing and what management. They can take care of surveillance because they have the technical expertise, contact tracing, and of course quarantining. Medical supplies, thank God we have the NMSA at this particular point in time. They have a very key role to play in terms of bringing in medical supplies and of course supply chain management. I have looked at the Ministry of Information and Communication along with the Ministry of Health and the Ministry of Social Welfare, where they can be very instrumental in the public information and communication campaigns, awareness raising and social mobilization. The key fact is that we cannot focus on just treating people, because if we say we're going to treat people, in the event that we have an index case, it's like saying let all 7 million people get infected, take them to treatment centers, who dies, dies, who survives, survives. And that's the wrong approach to actually fighting a pandemic of this nature. Then, of course, I have the Ministry of Internal Affairs. That's a key ministry where we have the ONS and the SLP, their role in providing security that I've actually itemized in a way. I'm not going to go through all of that. Then, of course, the key structure, the Emergency Response Center, which is going to be responsible for the what? Response and coordination, the interagency or interministerial communication and interpillar communication. That's going to be very critical. And, of course, data and dissemination. I can assure you that we got into a stage in the response where we could predict where the next cases will definitely come from. And data can do that. That's why I cannot overemphasize the need for the data and the ITC system. And I'm pretty sure that the minister has been working, has been doing some few things out there. All of that, we can basically ramp them up. And of course, in terms of standard operating procedures, I know the Ministry of Health, we left a lot of information with them in terms of screening, inbound travelers, their information that's going to be captured, because there is no way. One of the reasons that Nigeria has been very effective, even during Ebola, was because their contact tracing was very effective. But again, it was because of data. But once somebody slips through the wire cracks, we have a problem. So all of that we can basically, and we have standard operating procedures for that, quarantining and monitoring, the labs management, data management. I think we have SOPs if they are being outdated. Once everything starts, I think there will be a need for us to be able to maybe update them. Of course, I cannot overemphasize the need for transport, logistics, and supplies. That's going to be very critical. ICT system, I have spoken about that already. But the governance structure, Your Excellency, this is where your leadership is going to come in. Very, very critical. Clearly, I have identified 3 key layers that we should be thinking of, where we can, within a period of 72 hours, we can get into action. There is need to have a presidential task force immediately. It should be established, which will be responsible for coming up with the policies of the war response, basically. And of course, making sure they sanction anything that is going to be displayed to the war public. Of course, that body should be responsible for making all political decisions in the response. And of course, certainly, the ordinary citizen will always want to hear from their president. If you speak, whatever you say, people listen more. So that's going to be very critical at that level. And these people can basically come up with policies and they filter that to the second level, which is the response and coordinating center, which we have talked about, the EOC, where most of the implementation strategies are going to be implemented. And then, of course, we can monitor all operations and delivery of all teams involved in that. The people will be responsible for that. And, of course, we can make real-time decisions and tactical decisions that we can feed up to what? Level 3. And level 3, basically, the layer 3 is the pillars that we basically made use of. And I have made some few key recommendations, sir. One of them that, again, there is every reason wherein the Ministry of Health, the rules I have actually already, is part of their statutory responsibility, but they cannot be the people monitoring themselves. There should be an agency basically monitoring them. And I'm saying this out of experience. When I got into Ebola, the first day when I was brought from the US into the whole exercise, it was meetings upon meetings at the State House. Minister of Health was in charge, and I have tremendous respect for the people, their professionalism, but it became a talking shop for the most part. And information that was filtered out at the highest level was not always very accurate. I believe that people are more willing to accept bad news if it is accurate and consistent. But if you are giving them conflicting information, it becomes a real problem. So we need to avoid that as best as possible. So that's why I'm recommending that basically there is a need to have a governance structure over the entire response. And of course, again, I've mentioned ITC over and over again. And I think this is something that you may need to take leadership on as soon as possible. So in short, that's my briefing. And I think I have some documentation which will be of use to you. Thank you very much.
In terms of messaging and messenger, it would be appropriate to get the paramount chiefs involved right from the outset. Because when I go to my village and speak, they only see you as somebody who's educated and is from this village. But when the paramount chief speaks, they understand more and they tend to follow the instruction. So I would humbly suggest that we bring in the paramount chiefs as soon as possible.
For adding on to the experience you went through and to the Ministry of Health and Sanitation. Indeed, you are very right in saying 2014, 2015, 5 years back, there were issues. That was why the then government considered to create a governance structure outside the ministry. I will not ask those who were there 2014, 2015 to respond to that. I will just say this, that the Ministry of Health as at now is a far cry from what was available in 2014, 2015. Just as an example for you, there was a hemorrhagic fever, Lassa fever that occurred in this country, and the Ministry of Health activated all the pillars, which were in the rudimentary stage in 2014, to ensure we had one loss, after which every contact tracing occurred, every other individual exposed to the virus were also handled and treated. Let me say this, that the coronavirus started way back in December. And up to, by January, the EOC, which was in its rudimentary stage then, which is now a fully functional entity within the ministry, the Emergency Operations Center, was activated. that center had looked at all the pillars which were in the rudimentary stage then, which are now fully functional entities within the ministry. May I say this? We have not got any case yet. So there has been tendencies of contact tracing, but has not been fully operationalized. But every district have a team in readiness to go for it. So far, the 3 major entry points into Sierra Leone have been screened fully. This disease, the symptoms are talking about a temperature above 37.5. You're talking about coughing as well, or difficulty in breathing. This disease, we are also aware that it is in droplets that you go through. Some may reinterpret it as if it is airborne. It is not airborne, but it is something that moves through the air in droplets. Let me also say we are also aware that it exists far longer on surfaces. And the refraction of various surfaces would make it last in one surface longer than the other. The temperature of the environment would also make it last in some surfaces one than the other. To reach out to paramount chiefs, to reach out to interreligious council, to reach out to various stakeholders. The ministry is in partnership with the Ministry of Information and Communication, and we believe they have the wherewithal for us to be able to outreach. Indeed. We have quarantined. The next step was to be able to safeguard, protect. We've quarantined close to 100 people now.
I think Stephen has covered a lot of ground, so I will focus really what I want to say around how I think ICT systems can help make life a lot easier. I was central to the planning process, and like Stephen is saying, 2 things. 1 is data, 2 is communication. How quickly you can talk to people in the field can make the difference between getting control over what's going on and waiting too long, which can cause a problem. So when I left government 4 years ago, I went straight into the ICT world, and I went fresh with Ebola on my mind. So most of the things that I worked to develop, whether it's communication system, whether it's software systems, have been around health and health system strengthening, but also around how government can operate better. So 2 ministries I've worked with substantially are the Ministry of Health and more recently the Ministry of Information and Communication. So what I want to do is share with you some of the ongoing projects from an ICT point of view that both ministries are involved in, which I think lays the foundation. Maybe what needs to be done in some areas is to ramp up, scale up, and speed up the process of having these systems in place. So there are 4 things I'll talk about. One is called the Government Integrated Messaging System. This is a Ministry of Information project which is trying to connect all government ministries and departments in a central communication system. And this is not just for voice calls, it will also support conferencing, both audio and video. So the meeting we're holding now, for example, when this thing comes online, could have been held with everybody operating from their remote locations. Now this is important because should there be a situation where you need to restrict movement, you still need to have government be able to function, right? And that will support it. The second is the Public Health Emergency Communication System. So this is using the 117, but it's riding on the first communication system, but trying to enable real-time communication, not just between the Ministry of Health, but between everyone. So I'll share with you a slide later that says now when calls come into 117, they drop dead there, as in they can't route them. What we want to build is a system that functions like the 911, where if a call comes in, they can route it even to State House in real time, so you don't drop the caller. You can maintain them wherever. The third is the Public Health Incident Management System, which is a computer-aided dispatch system. What this tries to do is to maintain a command center situation room with full visibility of what's going on in the field. So with a system like this, you can run this room as a command center for an incident that is happening at the airport. So you can maintain video, audio, communication, live monitoring, and sending instructions in real time. The fourth is the Surveillance Management and Alert System. So what the Ministry of Health has right now is a disease surveillance system that allows the health workers across the field to update the cases that they're coming through. However, When that data comes in, somebody still needs to take it in the form of maybe Excel, and then the surveillance people check the counts to see if they meet the triggers for them to go into action. What this fourth is doing is pre-programming all of those rules and triggers for them to go into action, such that when the number of cases reaches that threshold, an email is sent, an SMS is sent, and the EOC is alerted that we now have 14 reported or suspected cases of this, and therefore people should go into action. So trying to automate. So like I said, these 4 projects are currently ongoing, but what has happened is either because of World Bank project management processes or something, they're moving at a fairly slow pace. So what could be done is quickly ramp them up and get them closed so that in a matter of days and not weeks, we can have them up and running. But just to speak a little more about the incident management system, it is something like this when it's done. So this room can be this screen here. What you see here will be field teams sending live video streams of what's going on. So it can be anything from a road accident to a suspected case of somebody showing symptoms. So if Dr. Jamba is the most experienced epidemiologist, a very young field officer wanting to do triage can actually send video streams directly to Dr. Jamba, and he can advise on what needs to be done about that patient. But then also, if a sample is collected and an ambulance is taking it to the nearest lab, you can actually pinpoint their location along whatever routes and roads they're driving on. If they stop and make a diversion, whether it's to drink palm wine or to do something, somebody can actually call them up and ask them what's happening. So you can maintain real-time situation awareness of something that is going on now, which is a live incident. The disease monitor I was talking about, what it's really trying to do is map all of the health centers in the country, but then take from the EIDSR data and show, for example, who is sending in data in real time and who is not. So if these people have been offline for 24 hours, they will know and they can call them up and say, why haven't you been sending data? But more importantly, these are really, in addition to them being heat maps, it is pre-programmed to send an email to the minister, to the CMO, to the director of HSC and many other people when this heat map extends from small to big, or when the number of cases reports. I talked about the 117, and this is the way it is right now. So right now the call comes in from the public to the call center. The way it is, they have a database system where they can log the call and record what's going on. But in terms of voice communication, there is a barrier between the call center and the DHMT. So what they do, they update the database, and these people have to log in via internet or something to access this database. What we're trying to implement is to superimpose the call center on top of the gyms, such that a call coming in can be routed to ONS, to the police, and to any DHMT without dropping the call, or to any MDA, including this office for that matter. So if it's something that is going on in real time, and you want to maintain contact with the caller, whether it's of a security nature or of a public health nature or any other emergency, you can actually maintain voice contact with them and pass them through different people in the government communication system. So going forward, because we have started some of these things, and clearly, Your Excellency, these will add value to what's going on. There are 4 things I would propose. 1, ramp up and ramp up quickly. Let's get these things sorted and closed within the shortest possible time. If it has to do with some little condition, let's get them out of the way. The second has to do with adding on. So most of what we're doing around those 4 systems are basic. So Minister Rado, says we have to move. Let's not wait for the big budget. So if we have just 400 million, let's start with that. So the gyms, for example, is covering only 17 MDAs. Incidentally, the Ministry of Health HQ is part of that network. But it does not include the DHMTs, it does not include Lunge and other places. So we need to add on to enhance these functionalities of what we have going on that were mostly pilot projects. The second is some areas that can be enhanced. So one area, from my experience, is the contact listing and contact tracing. Right now, there are forms that are well designed at the airport to collect who's coming on board, where they're going, and things like that. However, just having them on paper and waiting to be inputted down the line can make the difference between someone escaping what should be a net that should have been laid out. So what we're thinking of adding on to the disease monitor surveillance system is to automate that form and have everything that is captured in real time reflecting at the EOC. So if 46 people come out of a plane, within 1 hour the EOC knows that 46 people have come out of a plane, and they have everything from their mobile phone numbers to the addresses that they're going to lodge. So if 5 hours later something happens, they can quickly reach all of them by phone, or probably send teams out to go to their addresses where they're supposed to be and move them into isolation. And then the third is having remote situation rooms. So the way the Ministry of Health system is being implemented now is you can only have visuals if you go to their office. But it is possible to enable remote situation rooms, that is them seeing what they are seeing from police headquarters, from ONS, from State House, from wherever you want. So you can be in voice communications, you can view in real time everything, and you can give instructions. The fourth has to do with the contingency planning, and it's also ICT. We knew what happens with the schools closing down, and a lot of scrambling took place around how do we get the kids to continue learning. Well, let's hope it doesn't happen, but we need to use whatever systems are being implemented or were planned to be implemented, engage with the owners of the schools, the teachers' unions, to actually have a workable e-learning system, well rehearsed, so that should you give instructions for schools to shut down, what happens is they automatically activate. I must say here as a good news that the Minister of Information has gotten the MNOs to kind of agree in principle to provide what is known as zero rating. So that would be tariff-free access to e-learning systems if they are made available should there be a shutdown of the system. But I think it needs to move beyond just discussions to actual concrete arrangements, that you can have all of the schools having ways of logging in and viewing, whether it's pre-recorded lectures, whether it's past papers that are there, whatever needs to be done.
The virus is uncomfortably close, and we don't want to wait until it hits before we make further preparations. So you are here because we think there's a lot to learn from you. And what we need to do now, Chief, is to get together again and glean all of this information and what can be put together so that we can actually have a solid structure. At the end of the day, I think Sierra Leone should stand out. We want to stand out as being able to prevent, and should there be any case, contain and stamp it out as immediately as possible. And I believe we can do it from these experiences, and many more who are not in here. So we now need to blend what is in operation, bring more to it, and establish the structures. I completely agree that in as much as what we have may be different in terms of MOH, we need to have, can I call it a standalone operation center, and of course then you can, I said that to you this morning, you can pay attention to, you are going to be at the center of this because we are going to need a lot of information, but we are going to need a national structure to deal with this present situation. So I want to thank all of you. So let's put our heads together. This is actually a national threat. It has been elevated to that level, so we need to stamp it out. I just want us to stand out as a small country that has, now we are surrounded. Yes. We are surrounded. So, like General Taluba said, the likely approaches, where are we going to expect the enemy to come in from? Liberia or Guinea. So in as much as we are raising awareness here, our ambushes, Guinea border, Liberia border, and all the other borders, while we are keeping inside clean and quiet, telling them what we are doing, we have to ambush those areas. So that is the key issue. You are the general now. So we are fighting the virus. It's not soldiers coming in. So you have to work with the rest of the team to put something in place.